Thanks a million. Hi, everybody. I'd like to start by thanking Mental Health Reform for asking me to come here this evening. It's a very kindly invite. I'd also like to thank Mental Health Reform for choosing this topic. It's a very important issue, the issue of health services to people in crisis, and it's an area that certainly needs highlighting. From a bit of research that I've been doing around it, it looks to me like the people in crisis, there isn't much of a instant service out there across the country for people in crisis, and that's something that we really need to highlight. So for my part this evening, I'll be looking at the services available to people in an emergency situation, the policy and the reality. My lovely mum passed away on the 22nd of November 2012, and for a number of months before she died, unfortunately she was admitted a number of times to A&E. In fact, she joked that she'd been there so often that by rights she should have been given a loyalty card. I remember one particular visit more clearly than any of the others. I was sitting with Mum in a cubicle. The only thing between Mum and I and the patient in the next cubicle, a young woman, was a threadbare curtain. Mum was sleeping, and I was so close to the adjoining curtain that it was impossible not to hear every detail of the young woman's case. She was being assessed by a doctor who told her that she would have to go home and come back in the morning to have the deep gashes in her wrist stitched by a surgeon. I was so shocked by what I heard, and I heard everything. It was impossible not to. I heard this young woman give a full and detailed history of a short life blighted by mental illness. I don't know, and therefore cannot say, if a psychiatrist had seen her, she'd obviously made a serious attempt at ending her life. I sincerely hope that she did receive a psychiatric consult. Was there someone outside waiting to accompany her home? Was she returning to an empty house alone in her time of crisis? Did she return to have her wrists treated the next day? I don't know, and I probably never will, but I do think about her a lot, still to this day. What struck me about that night and the many others that I spent with Mum in A&E was how completely inappropriate an environment it is for anyone who is in mental distress. A&Es are scary places, full of very sick and not so sick people. Machines beeping, monitor alarms going off every few minutes, staff stretched to their limits, doing their very best under very difficult circumstances. Ambulances blaring, lights flashing, the drunk guy in the corner roaring at his friend, and privacy is non-existent. In fact, A&E is an assault on the senses, and for anyone who has suffered from an acute attack of anxiety or depression will know their senses are already over-heightened. So even a few minutes in a crowded A&E can be a torturous experience. Another case I heard about recently was that of a young boy aged just 16 who took an overdose. He sat in A&E for 2 days before he was seen by a general adult psychiatrist. There was no specialist in child psychiatry or aftercare service available, therefore the child spent 2 days in A&E. I have since learned that this is not unusual. It may not be unusual, ladies and gentlemen, but it is certainly unacceptable. A&E departments are no place for people with mental illness, yet due to lack of a coordinated national, out-of-hours mental health service in Ireland, this is where some people in acute mental distress end up. Not by choice, but because there is simply nowhere else for them to go. Emergency access for people with psychiatric illness is problematic, to say the least. While some community mental health teams are now developing an out-of-hours service, for example, from 8 a.m. to 8 p.m, and that is very welcome, others do not have an out-of-hours emergency on-call service, so often the A&E is the only place to go. As I have said, A&E is a really unhelpful place to be. If you are suicidal or depressed, sitting in a waiting room, you may not be seen as a priority, and that is a very different type of stigma. The vast majority of mental health difficulties are seen and cared for by primary care, and therefore the GP, in my mind, is one of the most important points of contact for people in distress. According to A Vision for Change, which is Ireland's national mental health policy, local multidisciplinary community mental health teams should provide a single point of access for primary care for advice, routine and crisis referral to all mental health services, including the community and hospital-based. However, unfortunately, that is not the case around the country. I spoke to GPs who told me that currently when someone needs an urgent psychiatric assessment, by and large they have no option but to refer them to A&E in the absence of an alternative or direct referral to a public psychiatric hospital. In the private system, however, GPs can refer patients directly into a psychiatric hospital if a bed is available and if that's what's needed by the patient. The other issue that continues to be a challenge for GPs is catchment areas. Ireland is broken into catchment areas, and GPs can only refer a patient into a public hospital in their catchment area. This can be a difficulty for GPs because if they send a patient to the wrong hospital for assessment, that hospital can refuse to see the patient and refer them to the correct one. However, did you know that one street in Dublin is divided right down the middle, with one side of the street allocated to one acute hospital and the other to another separate hospital? A busy GP trying to get a patient seen by a psychiatrist in an emergency situation has to ensure that the patient lives in the correct catchment area or on the right side of the street. There is even no national map available to GPs detailing which area belongs to which hospital. If you are homeless and have no fixed abode, where do you go? I believe that GPs and A&E professionals should be able to refer a distressed patient in crisis to a mental health specialist anytime, night or day, and where appropriate, that specialist should visit the person in distress in the least stressful environment, which for many is our own homes. Many people in crisis may well be able to be treated in their own homes and may not need inpatient care. Therefore, there is a need for a nationwide network of crisis resolution and home care teams for people with serious mental health who present, or those with first instance presentations who are in crisis and are candidates for inpatient admission. Studies have shown that these types of interventions can be hugely effective and negate the need for inpatient admission. According to a recent review, home-based care is thought to be feasible for about 55% of service users who would otherwise be admitted. Such care also appears to reduce costs and increase service user satisfaction. A Vision for Change recommends, recommendation 11.11, arrangements should be evolved and agreed within each community mental health team for the provision of 24/7 multidisciplinary crisis intervention. Each catchment area should have the facility of a crisis house to offer temporary low support accommodation if appropriate. I asked the HSE if 24/7 crisis intervention services were available throughout the country. The response I received was as follows: this information is not currently collated nationally. However, where there are concerns about an individual, they should be encouraged to see their GP or primary care practitioner for clinical assessment and appropriate intervention. There are pockets of excellence around the country where home-based care is available for people who are acutely ill. One example is in Clondalkin in Dublin, which has a home-based care service in operation since 1991. I know Dr. Gibbons is going to speak to you later on about his excellent work in Kildare, and I look forward to hearing more about it. The move away from psychiatric hospitals to the community is the backbone of a modern mental health service, and community mental health teams are vital in this. However, these teams need to be staffed and staffed appropriately. The latest figures from the HSE show that of the 416 posts provided for in 2012, 3 years later, the vast majority are 91% are either in place or finished the recruitment process, with a further 4% currently undergoing guarded clearance. Of the 477 posts provided last year, the HSE told me that almost 30% have completed recruitment. That means 2/3 are yet to be filled. However, the HSE said that a further third are well advanced in the recruitment process, and the balance either at post-selection approval or early stages of recruitment. The HSE hopes to have them in place by the second quarter of 2014. The HSE also said that 20 million funding provided in 2014 in its service plan was for 240 to 280 staff to be placed before the end of the year. The government's programme for government committed to providing an additional ring-fenced 35 million per year every year over the lifetime of the government for community mental health, and that was very welcome. While mental health received the promised 35 million in extra funding in 2012 and 2013, in 2014 it was just 20 million, 15 million short, and that was a huge disappointment. Just when you think that just maybe we are getting somewhere, when you think that maybe we're slowly building a modern mental health service accessible to all, you lose €15 million. Community mental health teams are, as I have said, vital. However, when you're in crisis, you need access to those services on a 24/7, 365 days a year basis. But as we know, this is currently not available across the country. As it stands, you need to restrict your crisis to between the hours of 9 to 5, and preferably have it in an area with a fully staffed community mental health team. I know that Marie will be talking about the postcode lottery and how an accident of geography can make a difference to the care that you receive when you're at your most vulnerable. This is not just the case, however, in an emergency situation, and unfortunately it continues to happen every day. For example, women in pregnancy who live outside Dublin are denied vital mental health supports at a time in their lives when their mental health is most vulnerable, due to the lack of any dedicated perinatal psychiatric service outside the three Dublin maternity hospitals. The problem is that currently in Ireland, dedicated specialist perinatal psychiatric services are not available by right to all pregnant women who need them. In fact, they are only available to those women who are lucky enough to live in or near the capital. I was in a crisis twice in my life, once in 2005 when I was suffering from an acute episode of clinical depression and anxiety. At that time, I was so sick I had to be admitted to hospital. Thanks to the fact that I have private health insurance, I was directly referred to a private psychiatric facility in Dublin where I was to remain for 7 weeks. I can't remember much about the time of my admission, but I know that I was both physically, emotionally and mentally exhausted. All I wanted was for it to stop. I couldn't imagine the horror of having to attend a busy, noisy A&E, never mind sit there for hours on end. The second time in 2009, I was once again lucky that with the support of a wonderful GP and psychiatrist who cared for me at home, I didn't need a hospital admission. I was extremely lucky that at those two most difficult times in my life, I was supported by the medical profession and by my wonderful friends and family. Many I know are not so lucky. And while it galls me to say it, as a patient in Ireland's increasingly inequitable health service, I was lucky enough to have private health insurance. I did hope that once the government implements the recommendations in a Vision for Change in full, that no patient would be disadvantaged through not having private health insurance. However, 7 years later, after its publication, we're still waiting. I would like to finish by thanking you all for listening, and also by thanking Mental Health Reform and all those organisations that are involved in mental health advocacy. I feel there has been a shift in the past few years that slowly, thanks to the work of service users and organisations like Mental Health Reform, spun out and See Change, the National Anti-Stigma Campaign, we are finally getting mental health on the national agenda. As we have seen with Budget 2014, however, it can seem at times like we are taking 35 million steps forward and 15 million steps back. However, the main thing is that we are not standing still. Thank you.